So tonight we are talking about healing and after perineal tears, which are something that's relatively common in a vaginal delivery. We know that around 50 to 80% of women who deliver vaginally experience some type of tearing. Now, there are different degrees of tearing, different structures that can be involved based upon the severity, but we're not going to go into that detail tonight. We're more so going to focus on things that you can do to help soothe that area because you may be experiencing pain, and also things that you can do to help those tissues heal. So, like I said, this is something that is relatively common. There's certain things that you also can do to prevent and decrease the chances of perineal tearing. So those are things important to know. But if you're watching this video, you're more so concerned about what can you do to heal, knowing that you've already experienced this. So the first thing that you can do when it comes to navigating a perineal tear is something that actually starts usually immediately after birth when you go to the bathroom. They typically hand you something like a peri bottle, or they hand you something so that way you can easily spray water in that area. And water being sprayed in this area can help to cleanse this area, to remove any type of bacteria, also to help remove any additional blood that may be there, because it is normal to have bleeding after delivery. And we want to make sure that we're doing the best that we can to keep this area dry and clean long term. Now, as you notice, I said dry and clean. That's not going to be completely possible, especially with the blood that is present, but the water can help cleanse as you're able to. In addition to using the water to help cleanse this area, the water can also be used to help soothe the tissues that are involved, especially in addition to the perineal tear, especially if you have like a laceration along the labia. Urine hitting that area can burn. So the water can help to dilute the urine and also to help soothe this area so that way that burning sensation is not as intense. So you actually can use this bottle, not just after going to the bathroom, but even as you are urinating. So that way, as you're urinating, as that stream is going, you can be spraying the area with the bottle as well. So when it comes to cleansing this area, you already heard me mention, we want to make sure that we're trying the best that we can. So you do want to change your pad regularly. That will allow for the tissues to be able to heal and also decrease the risk of infection. The pad itself should not be in place for longer than 4 hours at a time. Ideally, I prefer that my ladies change their pad or change whatever's in place every 2 hours at a maximum. And usually 2 hours at maximum, if you're staying properly hydrated, you're usually having to go to the bathroom around that time frame as well. So during this time, to help decrease the risk of infection, you should not be using anything that is inserted in the vaginal region. That can also disrupt the sutures that may have been needed with the perineal tearing that occurred, because sometimes they will have to stitch or suture you up. But even if suturing is not present, if you're inserting something inside the area, it still can disrupt that tissue as it is a bit more fragile. So nothing goes inside the vagina, not a tampon, not a cup, nothing to collect the blood. It should only be external things that we can use that are collecting and absorbing the blood that occurs normally after delivery. So with those things, just be mindful that we don't want to increase infection. So inserting anything in that area can increase that risk. We also want to make sure that you are keeping things clean, but you should not be scrubbing, especially not with like a loofah or anything like a rough towel through that area, nothing to exfoliate the skin in that area, because that can make you more susceptible, not just to skin irritation or even potentially reopen the wound if the wound's already healing. It can also increase the risk of infection in that area. So simply using water to spray through that area to help kind of get rid of any blood, get rid of anything else in that area, and then also patting dry with a towel, like a soft towel, nothing that is rough. And the same thing when you use the bathroom, you can either pat dry with a towel or even toilet paper, making sure that you're not rubbing in that area, especially if you're someone with a heavy hand, because that can be very uncomfortable. When it comes to the perineal healing, it takes time, and time is the biggest factor, but there are different things that you can do to help soothe these tissues so that way you're able to help promote healing. Something else that you can do is to help decrease swelling in the area. In order to decrease swelling, your provider may have already given you something like ibuprofen, which is an over-the-counter NSAID, so that way you can help minimize swelling. That also will help with pain. But if that's something that was not provided to you, then you can still decrease the swelling by using ice. Nowadays, they make something called padsicles, so you can even make your own at home. A padsicle is pretty much something that is frozen that works or functions as a pad that you're going to slip within to the underwear region, so that way you can have that direct cold contact. Now, generally with the padsicles, it's not the ice directly onto your vulva, onto that area. We want to usually have a layer in between, and a lot of padsicles now come with like a little cloth layer on top, but if not, you can simply place a towel there or even a thinner garment to help line that region, so that way you don't have the ice in direct contact. Now, there is a trick that some people use to help get the padsicle a little bit colder, and that is right after you take it out the freezer, you can sprinkle water on top of it, so that way now you can insert it. Just be mindful that if it is colder, you're going to feel that coldness. And if you're someone who does not tolerate cold well, then you may want to skip that tip right there, okay? But the increased coldness itself, your body's going to go through different phases as it adjusts to the cold and also as it helps to numb that area, because the purpose of the ice is not just to help with swelling, but it also can help numb that area. So you may notice like, oh, this is really cold. Oh, this feels a little burny or stingy in relationship to the ice. And then typically after that, that region will go numb. With the padsicle, I normally tell people, let's leave it in place for somewhere between 20 to 30 minutes if you can tolerate it. If not, go ahead and remove that from your perineum. But padsicles can be extremely helpful. For the different things that I describe, I'm going to put links down into the comments, to the description, I'm sorry, so that way you can find this information and make it a little bit easier for your search, and you know exactly different products that you can look at to help with perineal healing. So we talked about swelling. I talked a little bit about pain when I mentioned ibuprofen and also ice, but there's also a topical or local anesthetic that you can use to help with pain. One of the most common ones is something called Dermaplast, and that is used as a spray. You spray directly on the area, and it has like a cold-like sensation, but also helps to numb the area as well. There are some products such as Mama Frieda that makes one specifically for the perineal region, but even Dermaplast is something that you'll see hospitals use, birthing centers use, so that way women, when they're having that pain there, they're able to help decrease it. It's also pretty commonly used as that topical anesthetic when individuals need to be sutured in different areas, including my women when they're having to be sutured in the perineal region. So there are different pain relief options: that Dermaplast, ibuprofen, talk with your provider, and also ice. So there are different things that you can do to help with the pain. But let's say, you're doing those different things, but warmth is something that really helps to provide you with more comfort instead of the cold. And there's something else that you can do to help in this area is to do warm sitz baths, where you can actually sit in water itself, so that way you're able to have, and you're only spending just a short period of time there, you're able to have the warmth of the water to help increase circulation there, increase the warmth there, allow for the tissues to help relax, especially when it comes to the muscles in that area. And you even can add soothing agents such as witch hazel to that warm sitz bath to help provide you with more relief. Now, witch hazel is something that can be really good when it comes to helping decrease pain, not just the perineal region, but also when it comes to hemorrhoids at the anal region. And hemorrhoids is something that is relatively common during pregnancy and in the postpartum period. So if you're having hemorrhoids, go ahead and try some witch hazel, maybe even with a sitz bath. But if you're someone who does not want to sit in a sitz bath and do not enjoy that, then you also can try just the witch hazel's pads as well. And specifically for hemorrhoids, you would place that directly in between the butt cheeks, right at the anal region. If you're trying to use the witch hazel pad for relief of the perineum, you can place that directly on top of your padsicle. If you want to use it with your padsicle, you place it directly on top of there, even on the insert for whatever pad you're using with your underwear, and then you can place that at the perineal region to help give you relief. So witch hazel can be very beneficial. So we've talked a little bit about things that you can do to help with swelling, things you can do to help with pain. And sometimes when it comes to pain, you can be doing everything right, but if you sit for too long, that can also cause increased pain in the perineal region. And for some women, it may delay healing. So if you're someone who's had more of a significant tear, like a grade 3 or grade 4, then sitting too long may not be an option, not just to pain, but also because we want to allow those tissues to heal. And at times, too much pressure can decrease the healing rate. So in these cases, I'll tell my ladies, let's see if we can get you to spend more time on your side. In a side lying position, you're still able to do other activities such as feeding the baby. If you want to read a book, you can go into that position as well to read a book. You can sleep in a side lying position, and that will help you to offload the perineum, offload the vulvar region. So now you can allow for that area to have more relief. But let's say you have to sit because you have a task that you need to get done, or you just want to sit to do something else. Who knows? But if you're sitting for too long and causing pain, there is something that you can add to your chair. And if you're thinking a cushion, then you're thinking along the right lines. But I just want to make sure that I give you my personal take and my preference when it comes to the cushions. I personally do not like the donut cushions when it comes to perineal healing, because in some cases it can cause stagnation or decrease the lymph flow and also the venous flow in this region, which may increase swelling. So keep that in mind. If you're using a donut and you haven't had any issues, fine. But if you're not using a donut cushion and you're trying to decide on cushions, there are other options that are available out there, so that way you can get the relief without having to worry about any potential side effects from that simple little cutout. As a whole, donut cushions are not my favorite, but I know at times some individuals do prefer them. So make sure that you talk with your provider as well to see which option is best for you. There are times, especially if someone's having a lot of swelling in this area, where a good pair of biker shorts may go a long way. And the biker shorts itself can help provide you with just a little bit of compression, so that way it can help with swelling in that area, but it also can help provide that compression, so that way now you don't feel as if you're straining when you're doing certain activities where your core may need to kick in. And remember, the core usually is not as strong in the postpartum period, especially that immediate postpartum period. So compression shorts or compression tights can be really beneficial when it comes to helping to maintain swelling. And if you have less swelling, that generally means that you also will have less pain in that area. So for the different things that I mentioned throughout this video, I'll go ahead and make sure that those links are down in the comments, so that way you can at least take a look to see what options are available and locate them easier. But now that we've talked a little bit about healing the perineum after tearing occurs during a birth and delivery, I think it's important that we also talk about some warning signs, some things that you need to be mindful of, because infection, we are at higher risk for infection when there is an open wound. And with lacerations and tearing, you have an open wound. So you already heard me harp on making sure you don't insert anything in the vaginal region, and also making sure that you don't do too much scrubbing or use something like a loofah in this area, any type of exfoliating object. But also know that even with those things being said, even with avoiding those, at times, sometimes infections can occur. So doing the best that you can to keep the area clean, keeping it dry with those frequent pad changes. But if you notice that you're having a strong odor, or you're noticing discharge that is a strange color, it's like a thick color, more yellow, greenish, those different things, then I want you to contact your provider, so that way you can have cultures done, you can talk with them to see and determine whether or not the infection is going on. Also, other signs of infection are your pain levels increase. You start having a fever. You start having significant or unexplained redness in that area. So some mild redness may be present just simply because of the birthing process. But if it becomes excessive and is more than what you previously had, it's time that we take a look and figure out what's going on. So watch out for those signs of infection. Do everything that you can to help minimize the risk of infection. And also, just to give you some reassurance, most women do not end up with an infection in the perineal region or in the vulvar region following a vaginal delivery. But it's still important that we at least take time to make sure that you are aware of the signs. So let me know if you have any questions or comments about this information that I've shared. Talk with your provider to see what options are available for you. And also, please seek out pelvic floor physical therapy, because therapy can help your pelvic floor continue to heal. It's just gone through the lengthy process of carrying a baby for 9 months, and also in this case, delivering the baby vaginally. Even without a vaginal delivery, pelvic floor therapy is still recommended. With perineal tears, sometimes you can have an increased risk of pelvic floor dysfunction, especially when it comes to things such as pelvic organ prolapse, incontinence, depending on the severity of the tear itself, that may even include fecal incontinence. So find a pelvic floor therapist, so that way we can work with you on getting these muscles to better control, teaching you different tips and tricks, and also you may need additional help with some things such as pessaries or any type of other orthotic device as well. but a pelvic floor therapist can guide your care and get you back to feeling like yourself, because the postpartum period is a journey and you should have the support, not just the mental support, but the physical support, and that includes your pelvic floor. So let me know if you have any questions, and if you haven't already, please subscribe, because it'd be great to have you on the channel as we release more information when it comes to pelvic health and also general physical therapy topics. Thanks.